This is Rural Health Leadership Radio.
Hi, everybody. Welcome to this special edition of Rural Health Leadership Radio. I am your host, Dr. Bill Oxier, and I want to welcome you all to our special episode today. But more importantly, I want to thank today's guest, Jordan Tenenbaum, for joining us to the program. Jordan is the Executive Vice President for Allevant Solutions. That's an organization that was developed by the Mayo Clinic and Select Medical. So welcome to Rural Health Leadership Radio, Jordan.
Thanks so much, Bill. Glad to be here.
Yeah, well, I'm glad you're here too. So tell us about yourself. Who is Jordan Tenenbaum? What's your story?
Yeah, so I grew up in New Jersey with my mother and my sister. And I'd say I was always a curious kid, often looked forward to traveling. Moved to the Midwest to attend the undergrad at the University of Wisconsin in Madison, where I met my wife, Marissa. We both came to Washington University in St. Louis, Missouri for grad school. Marissa, my wife, attended medical school. I came here for a master's in hospital administration. I did administrative fellowship at Thomas Jefferson University Hospital in Philadelphia. And we ended up back in St. Louis where Marissa started her residency in plastic surgery, and I started working for Tenet Healthcare. And over time, I served as the COO and CEO of both PPS hospitals and specialty hospitals, including the CEO role at a long-term acute care hospital in the St. Louis region for Select Medical. Select Medical, as you know, is our joint venture partner, which eventually led to my role as Allevant, where I serve as the EVP for business development. This year, I'm also excited. I'm participating as a NRHA Rural Hospital Policy Fellow, so that's been a lot of fun. And the NRHA, we've been partners with NRHA for a while. They're so great to work with, and all of their efforts on the policy side is just amazing. So I'm really excited to be a part of that. I live here in outside of St. Louis in Missouri with my wife. She's an academic plastic surgeon. She's also faculty, oversees a residency program for plastic surgery at Washington University in St. Louis. We live here outside of St. Louis in Missouri with our three amazing kids. My son Eli, 15, Zoe, 12, and Alina, who's 10.
Well, you got a full plate, it sounds like, and interesting life journey from New Jersey to St. Louis, the Archway City. So thank you for sharing that with us. Why? It sounds like healthcare runs in the family. Why did you choose healthcare as an occupational path?
Yeah, it's a good question. My dad was a chiropractor growing up, and I remember at an early age just being in his office, and his patients, as a young kid, would tell me how grateful they were for him as doing what he did. And something about that experience just really touched me, how someone in need expressed such an appreciation for someone who trained to learn how to help them. So I guess since then, I've always been interested in healthcare. I really love the science. I love helping people. I believe healthcare is a right, not a privilege. And I've always been honored to work with and fascinated by people who really dedicate their careers, and in many cases their lives, to helping others. So I've just always been drawn to it.
Yeah, that's cool. Thank you. Now, that explains why you chose healthcare. Why rural health? Why are you focused on rural health these days?
Yeah, really good question. So for me, I think it was because I felt like it was a place I could help make a difference. And I was really drawn to the people in rural healthcare and the people I met and the places I visited, so many beautiful rural places across the country. And as a company, rural healthcare has really been our focus from day one. When we launched as Allevant, the JV between Mayo Clinic and Select Medical since 2012. So, at that time, Mayo Clinic managed 12 critical access hospitals, and our medical director and founder, Dr. Mark Lindsay, well accomplished. He was trained as an internal medicine, pulmonary and critical care medicine. He served in a variety of leadership roles at Mayo Clinic, including the department chair of pulmonary and critical care at Mayo Clinic Eau Claire. He was also the physician chair of ICU redesign and medical director for Valley Health Plan. He was a medical director of the ventilator program in Chippewa Falls, Wisconsin, which wasn't part of Mayo Clinic. but he helped support. He was the chair of Eau Claire's Continuum of Care Program Utilization Management for about 6 years. And he was a quality officer for Mayo Clinic Health System for about 4 years. And in all of those leadership roles, he was helping the system try to identify better pathways for post-acute care. They had a lot of challenges in their bottlenecks of care. They were canceling elective surgeries. They had high readmission rates, really struggled to find strong post-acute care partners. And he identified very quickly, based on the pulmonary support that he provided for those 12 critical access hospitals, that they really had this infrastructure that could create a better pathway for post-acute care, better than any that they were utilizing at the time. So rather than pushing patients, telling physicians their patients no longer met criteria, he said, well, why don't we train and educate the teams to care for the types of patients we need them to care for, and create more of a pathway that was a pull for patients, creating high quality post-acute care options. And so it turned out to be a huge win for the PPS hospitals, a huge win for the critical access hospitals financially on both sides, and most importantly, just a huge win for the patients, being able to receive high quality post-acute care closer to home with their friends and family, and their physician and provider team. So rural healthcare really has been a focus of our company since day one, and I've just been honored to be able to work with the people that we work with across the country, and it's been so much fun.
Yeah, that's great. Again, interesting journey, interesting path on how you came to focus on rural health. Well, Jordan, as you know, the name of this program is Rural Health Leadership Radio, and I emphasize the word leadership. And you were talking about leadership with Dr. Lindsay and yourself, for that matter. What's your definition of leadership?
Yeah. First of all, I love your podcast, Bill. So it's fun to be on this Zoom and hearing so many great leaders in rural healthcare talk about what they do.
Thank you.
It kind of forced me to think a lot about it. And I've been in a variety of leadership roles, both being a leader and also being a follower of leaders. So I feel like I've seen some great experiences and examples of great leaders. And so to me, I think about the concept of brave leadership. And it's I used to read this bedtime story to my kids called "Sorry is the Hardest Word." And so, to me, brave leadership doesn't mean you act by flexing your muscles or your authority. It means you act with humility, which I've witnessed sometimes is the hardest thing for most people to do. It really takes inner strength and bravery to admit, for example, that you did something wrong. So, the idea of brave leadership is kind of pulls away from traditional leadership or traditional leadership styles where, authority is more a team approach versus, a top-down approach. Information is shared with transparency versus a need-to-know basis. Idea generation is really bottom up, created by the team, bottom up. Conflict resolution is also considered bottom up. Feedback is immediate versus kind of this annual, feedback that you give teams. And then of course there's confidence and optimism. So to me that's brave leadership. It's also interesting. You may know Friday was Jeff Weiner's last day as the CEO of LinkedIn, where he served 11 and a half years as the CEO. And in a post you may have seen on LinkedIn, I know a lot of your followers on LinkedIn, he summarized his experience in one word, and that word was Ubuntu, which is a Bantu word that loosely is defined meaning humanity, or the way in which we're all connected. A more literal translation really is I am because we are. So it's this idea that the team works together to create the outcomes of the organization, and you can't get anything done with that team. And that's really a philosophy that we aspire to, and a culture that we aspire to at Allevant. And we have a mnemonic that we call CREATE, which is really about team. It's about creating a positive culture. And rural hospitals traditionally have a very positive culture, but there's always opportunities to improve upon that culture. So a lot of what we do is deep rooted in culture and teamwork, and working together as a team. So I'm really, really proud that we engender that as a company.
I love the fact that you use the word brave right from the get-go on your definition of leadership, as well as several of the other things you shared there. No doubt why you're such a great leader, Jordan. So thank you for sharing that definition with us. So you've spoke a little bit already about who Allevant is and all that, but can you give us an overview of Allevant Solutions and the communities that you serve?
Yeah, absolutely. So Allevant, as you pointed out, is a joint venture between Mayo Clinic and Select Medical, and we help critical access hospitals succeed through the development of transitional care programs to help grow their swing bed volume. So our goal is to help cause critical access hospitals become experts in post-acute care through discipline-specific training and education, process training and education. We also have a database to help cause track outcome measures, process measures, as well as business development efforts. And we really believe that evidence-based processes lead to consistent quality outcomes, which drives the growth and results of the program. We also help market the programs, utilize data to help tell the story to referral sources, internal key stakeholders, as well as the community. So to date, since we started in 2012, we've worked with over 70 critical access hospitals in 18 states. We've worked with skilled nursing facilities, PPS hospitals, trying to identify narrow networks of critical access hospitals. We've worked with health systems. The model works with independent critical access hospitals that want to maintain their independence. It also works with health systems or PPS hospitals that are looking to generate strong post-acute care networks with critical access hospitals. We've had a lot of success doing it over the years. We just put out some data where our clients have cared for over 8,500 patients, representing over 111,000 swing bed days.
Wow.
The average patient rating was a 4.2 out of 5 when asked if the patient received excellent care from their care team. 76.9% of over 8,000 patients were discharged from transitional care back to home or assisted living, which really is significant when you look at readmission rates in the industry.
Absolutely.
And 6.5% of transitional care patients were discharged directly back to acute care within 30 days in our programs. 62% of patients admitted transitional care were categorized as complex medical or complex surgical. So one of our primary goals is over time to help the teams feel more confident and comfortable caring for more complex patients. The traditional ortho patients are going home. So critical access hospitals need to be able to utilize their resources to care for more complex patients over time. And it doesn't happen overnight, but organically with the right team, the right processes, the right leadership, the right training and education, and the right measurement tools, it happens over time. And so the average growth for our hospital since we started is 25% the first year. The second year is 49% growth in their swing bed. So we've had success, and we're really positive and confident and honored to be able to work with the critical access hospitals that we've worked with across the country to help them continue to focus on their strategic priorities.
Yeah, with those numbers you were quoting, man, you're truly making a difference. Just like those folks that went to see your dad, talking about how much he helped them. You're really making a difference helping those critical access hospitals with this service. So that's pretty cool. How has the COVID-19 pandemic impacted things for you and your clients?
Yeah, so obviously we've not been able to travel, which is tough for me in my role, of course.
Yeah.
But it's forced us to be more innovative. I think like many of us in doing how we do things. So our goal has been trying to add value to rural hospitals and rural healthcare providers and not overburden them. There's a lot of information out there. So we've created a landing page, for example, on our website with a host of resources, free resources to help critical access hospitals during this time. And cause have not been able to focus on elective procedures and outpatient services across the country. So the swing bed program really is a critical pathway for many organizations to help get through this challenge. And we've always felt the critical access hospital should be the best post-acute care partner for PPS hospitals. And this only pushes that concept further in the right direction. And there's a lot more flexibility with the waivers that have come out to help rural hospitals in this space. We also know that cash flows been very challenging for many critical access hospitals across the country. So, we've created a unique program offering for critical access hospitals to help during this time to overcome those obstacles. So, we're trying to be innovative and trying to recognize the challenges right now for rural hospitals and be value and be a resource for them.
Yeah, we always talk about how rural healthcare is known for innovation. Your company is a true innovator, and the more innovative we can be in difficult times, the better for everyone. Jordan,
Absolutely.
you've already kind of touched on this as well, but if you could drill down on a little bit more, why rural hospitals, why rural health is so important to Allevant?
Yeah. So, rural health has really been our primary focus from day one. Our model was developed by rural hospitals, those rural hospitals in the Mayo Clinic system for rural hospitals. I mean, they, through those original projects, those teams came up with the ideas that, we've evolved over time and just continue to improve by collaborating with our clients up till now. So, we really view our relationships with our clients as a collaboration. We hope to learn from as much as from them as they learn from us. And by working together, we hope we can accomplish so much more than by working independently. And that's really our goal.
Yeah, so it sounds to me like, there's a lot of companies that serve rural hospitals, but they also serve urban hospitals and that sort of thing. But it sounds like Allevant is totally focused on rural hospitals. Is that right?
Absolutely.
Yeah.
Yep.
Okay. All right. So let's say, you're a former hospital CEO, and I'm sure you talk to a lot of rural hospital CEOs. If a rural hospital CEO is thinking about using an outside source for the services that you provide, can you talk about some of the top three things that he or she needs to look for or consider when choosing that outside provider?
Yeah, that's a great question. I would say top three. The first would probably be the experience of the team. Our program started at Mayo Clinic, and we have support from both Mayo Clinic and Select Medical. Select Medical is the company that I came from. It's recognized by Forbes as one of the best managed companies in America. It focuses on critical illness recovery, inpatient rehab, outpatient physical therapy, and occupational medicine all over the country. So, deep expertise in post-acute care. And we all know the history and the experience and the team coming from Mayo Clinic. So our team, Allevant, is kind of a product of those two companies. Um, you know, Dr. Lindsay, I can't say enough about Dr. Mark Lindsay. He's our physician, medical director, and founder. He leads all of our implementations, and he really kind of drives the culture of organization, which helps to support improving the culture in rural hospitals. And so, when I managed uh, uh, our LTAC for Select Medical, I always tell him this, that he's the type of physician that I would love to be working with in an organization like that, a provider organization, because he just creates this positive culture. He's the type of physician that if a nurse calls in the middle of the night and wakes him up because of maybe an issue that shouldn't have been an issue throughout the night, he's not gonna, he's very positive about it. He uses it as an experience to work together as a team. And so, it's just a valuable resource, I think, for our company and our clients. So it's great to have him leading all of our implementations. We also have experience from an ICU trained nurse leader with a focus on quality and project management, who's just terrific, Carl. An amazing nurse and clinical educator and wellness coordinator. And Rory, deep expertise in marketing, rural health transformation, rural health grants, and in Monica. So, just some members of our team that I think, our clients have access to. So the experience of the team, both from where we came from, the folks they'll be working with is really important. Number two, I'd say the quality of the education provided. Allevant's an accredited provider with distinction with the American Nurses Credentialing Center, which means that nurses and other healthcare providers get accredited CNEs for taking our education. So, we're a clinical training and education company, and that's what we're very proud of. And so I think that comes across in our education material. We try to make it easy for staff to change what they've been doing for so long, to change their processes, to learn new things, to be able to care for a different type of patient population over time. And then the third thing I'd say is really just a comprehensive approach to the program. We're laser focused on helping critical access hospitals improve the quality and grow their swing bed programs. And so, that requires a multi-pronged approach, helping them feel confident and comfortable caring for more complex patients over time through training, putting evidence-based processes into place, creating a positive culture, measuring outcomes and effectiveness of those processes, and of course, the marketing, education, and support. So, those three things: experience of the team, quality of the education provided, comprehensive approach to the program, I think are paramount.
Yeah, it sounds like great advice. Thank you for that. Now, with all the hospitals, all the rural hospitals that you've seen implement a swing bed program, what are some of the best practices that you've seen some of the top rural health leaders embrace when they've done that?
Yeah, that's a great question. I would say having a strategic, administrative, and clinical leader focused on process and education and putting the right people in the right roles is kind of a best practice and really should be a focus in starting a program like this.
Okay.
If you're not spending time as a team making this a priority, it's not going to be a priority.
Right.
Focus on data is really critical, and definitely a best practice. The ability to see patterns. If you're saying, looking back at your data for how you're utilizing your referral development, and you're identifying that you're saying no to a certain type of patient, so the team should be asking themselves, what would it take to say yes to this patient next time, right? So to really expand your capabilities of caring for those patients over time. And then maybe, being able to tell the story in a cohesive, data-driven way, and consistently to internal key stakeholders, community, your local community, and certainly referral sources, I think are really kind of the best practices that we help our clients with, but also see out in the field.
Okay, great. Thanks for sharing those. I always love it when we can share best practices with other rural health leaders. So thank you for that.
Yeah.
In all I forget what the exact numbers were. In the beginning of our conversation here, you were talking about all the critical access hospitals that you've worked with and seen implement a swing bed room program. Can you think of one particular client or customer that really benefited from your assistance and what happened, kind of the results of that implementation?
Yeah, absolutely. So one of our very first clients was an independent critical access hospital, and they really viewed growing their swing bed program was as a strategic priority, and so they partnered with us early on to help them to do that. And the outcomes, I think, are kind of mimic the outcomes we've had over time. But I'll talk a little bit about that. But they had a 560% growth in swing bed days, which led to growth in ancillary and outpatient areas. They had a 59% of their patients were complex medical and surgical. About 14% were neuro. So, really, again, kind of elevating the types of patients they can care for. So 14% were neurorespiratory and wound, 59% complex medical and surgical. The program's success helped contribute to the facility being able to construct a 12,000 square foot, $4.1 million addition. So,
Wow.
Had they not had this increase in cash flow, they wouldn't be in a position to invest in their facility like that. So, it really is a foundational program that has implications throughout the organization over time in a really positive way. 100% of their transitional care patients rated them 100% when asked if the care provider was excellent, willing to recommend. So really positive patient experience, which is critical. 7.6% of swing bed patients were readmitted to acute care hospital within 30 days. So again, within that single digits, the market is typically up in the high teens, comparably. Positive net margin impact of 29%. They had a 220% return on investment. But I'll tell you, Bill, that the best part, when I sat down with the CEO, he's since retired, but he shared with me that, he had all of these great kind of results of the program, but one of the things that stuck out in his mind was the ability to have enough volume to keep full-time work for their staff. So, it really is this kind of program that not only helps focus on swing, but really has a ripple effect throughout the organization. So they were in a position where they weren't they were able to give full-time hours to their staff on a long-term basis, which was critical. So that was that hospital. I'll give one other example. We've worked with 18 hospitals in a state in the northwest part of the country. This was a state-funded program, and those 18 hospitals overall had tremendous results. Growth in total referrals was 98%. Growth in external referrals was about 178%. Growth in their swing bed days was about 84%. So this was 18 hospitals in the state, and so we're looking to partner with other states and partner with other critical access hospitals or collaboratives to learn from these results and hopefully have similar experiences.
Yeah, those are some pretty big numbers you're throwing around there, young man. That's pretty incredible. Well, thank you for sharing that.
Thank you.
Jordan, you've worked in rural health for quite a while now. You're a former hospital administrator. You know a lot about healthcare, I guess. You've established that fact in our conversation today. So when you look at rural healthcare and the future of rural healthcare, what scares you the most about the future of rural health?
That's a great question. Before the pandemic, rural hospitals viewed themselves as being in a crisis mode, and I'm sure, Bill, you've heard this as well. There were 18 closures. 2019 was the single worst year of the crisis. There's been, I think, 18 closures already this year. Our good friends at Charter Center for Rural Health shows that closures accelerated, and 453 out of 823 rural hospitals were vulnerable to closure. The percent of hospitals operating in the red was up from 39% in 2010 to 47% in 2019. Remember, this is before the pandemic. So,
right.
So this pandemic potentially has the opportunity to make things much worse. So the data from that study highlights 16 indicators determined to be important predictors of hospital closure, and 9 of which were determined to be statistically relevant. And the number one predictor is expansion of Medicaid. We've heard that before. Hospitals are 62% decrease in likelihood of closure if they are located in an expansion state. But our program impacts 44% of these 9 statistically relevant predictors,
Oh, wow.
which includes percentage of total change in revenue, percentage of occupancy, case mix index, and percentage of capital efficiency. So, I think the thing that scares me the most is what could happen to rural healthcare, what could happen to our rural communities. But I think there's a lot of bright spots throughout the country, and just hearing some of the folks that you interview in your podcast, we hear a lot of those throughout the country, and so I think we need to stay laser focused. Folks need to continue to support organizations like the NRHA from a policy perspective, and take it upon themselves to make sure that we're all saying the same thing from a policy perspective. And I think we'll get through this, but these are very challenging times for rural hospitals right now.
Yes, definitely are. But it sounds like they need to talk to you if they're having troubles, Jordan. So you mentioned bright spots. What excites you the most about the future of rural health?
Yeah. So I guess we believe that rural healthcare is innovative out of necessity, and it's this innovation that can really help lead the way for the future of patient care. Rural hospitals are so much more nimble and flexible than larger urban hospitals, and it's this innovation out of necessity that I think will propel them to be able to strategically evolve uh, in the long term. So, we're really excited about the science that supports concepts to improve health and wellness in our rural communities. And we're actively exploring a model Dr. Lindsay is developing in this space. So, it allow the innovation out of necessity for rural hospitals forces us to be innovative as well. And so, we're looking forward to continue to collaborate and partner with rural hospitals as they evolve, because we believe it can happen faster in rural healthcare than it can in other healthcare arenas.
Yes, and that is exciting. So thank you for sharing that. Jordan, the time has flown by while we've been talking here today. If our listeners only take one thing away from the conversation today, what should that be?
Yeah, this is a good question. I think there's so many things to be proud of in rural, and so many people are making such a positive, meaningful difference across the country. And again, I love hearing about them in your podcast, Bill. So thank you for your continued efforts in doing that. But folks were to take anything from our conversation today, I think every critical access hospital should at least explore transitional care as a strategic focus. The financial and quality arguments are just too strong not to consider. Um, I'll also say that we're happy to provide a free financial model for critical access hospitals that are interested in exploring, that want to better understand the feasibility of engaging Allevant in a program like this. But even if they don't work with us, they should seriously look at transitional care or growing their swing bed volume as that foundational service line that's going to help propel them and prepare them for what's to come in rural. So,
Jordan Tenenbaum, Executive Vice President of Allevant Solutions, thank you so much for joining us today and sharing your knowledge and expertise.
thank you, Bill. It's been a pleasure. It's been so much fun and an honor. Thank you very much.
Thank you. If any of you listening today would like to connect with Jordan, you can send him an email to jtenenbaum@allevant.com. That's JTENENBAUM at ALLEVANT.com. You can also find Jordan's contact information in the notes below this video. And if nothing else, you can always reach out to me and I'll be glad to connect you with Jordan. You can learn more about Allevant Solutions by visiting their website at www.allevant.com. And if you'd like to learn more about Rural Health Leadership Radio, guess what? We have a website too, and you can visit that at rhlradio.com, or simply search on your smartphone using your podcast app and subscribe to Rural Health Leadership Radio. If you enjoyed this special episode of Rural Health Leadership Radio, or you know someone who might benefit from it, please share. We are here to serve you. Until next time, let's keep working to improve rural health, one conversation at a time.